Welcome back to New Hampshire.
Thanks, Laura.
I'm sure you're very aware that May is Mental Health Awareness Month. Our own Governor Sununu signed a proclamation, and this week, I think it's maybe Thursday, is National Mental Health Action Day. So you talked about mental health in your state of Indiana and the importance of providing it for everyone. I'm a psychologist. I've been a psychologist for 40 years now.
Great.
And I'm a grandmother as well. And I'm seeing a national mental health crisis. This is a
Yes.
marathon, and it's not a sprint. The children and teenagers that I see are in for a long haul in their challenges. I'm very concerned about the 22 plus suicides a day in our military. The LGBTQ community is at high risk for mental health crises, and 1 out of 3 adolescent girls are considering suicide and are depressed and or anxious. So, given all of that, what are your presidential plans to directly, concretely address this issue? And would you be willing to appoint a mental health czar and a commission to go along with that?
Well, I think it's a marvelous idea. I've never liked the term czar.
Me neither.
Right.
But I don't know what else to use.
But you make such a great point.
Thank you.
In the wake of the worst pandemic in 100 years, there's a new epidemic in America. And it's a mental health crisis
Yes, sir.
among young people, among various groups of Americans. And I think some of it comes out of COVID. You're the psychologist. I think some of it comes out of the isolation in COVID. For young people, I think it also comes out of the isolation in social media, which sounds like an oxymoron, but actually kids that are living on their phone instead of interacting with friends in person end up really struggling with depression and with loneliness. And so I think we've got to lean into this effort. I mentioned my wife Karen before, when one of her initiatives when she was second lady of the United States was called the Prevents Initiative. It was to prevent suicide among our veterans, but during COVID we broadened it out across the country to kind of raise awareness. My wife coined the phrase during those days. She said it's okay to say you're not okay. And it's something I'm sure you tell your patients on a regular basis, is just first come forward and tell people you're struggling with an issue, and then making sure that states and localities have the resources to come alongside people. But in a very real sense, we're going through for our kids and for many people in the population an epidemic of mental health, and I think we can deal with it. We can look to the experts, we can engage, we can strengthen families in America. I love that Bible verse that says he puts the lonely in families. And so strengthening families is also a way that we deal with helping people achieve a greater sense of wholeness in their lives. But at the end of the day, when it comes to people that might represent a threat to themselves or a danger to others, I think we got to get back to institutional mental health care. I really do. In the 1970s, we all walked away from it as a country.
We've improved it. I worked inpatient as well.
Well,
but we got to keep working on it. And I think a great leader, and you know this in public service, relies on those who are experts in their fields.
We did. And when I was governor, that's why we broke ground and built the first mental health hospital in 30 years in Indiana, because I heard from mental health experts. I heard from law enforcement. They just said, we just don't have anywhere to go when we've got someone that has a problem, could potentially be a danger to themselves or others. But I think we need to think more broadly about that. Particularly, it's also the relationship between mental health, benign, not dangerous, issues, and homelessness is extraordinary. And there are many people living in homeless lives today that we ought to, as a nation, have somewhere they can be cared for. And we ought to seek to do that. But I appreciate your work.
Thank you very much.
And thank you.
Next